The thing is, as far as her blood reports go, we had first day she came, I had a doubt she probably has something serious inside her. ಅದಕ್ಕೆ ಅವರನ್ನು ಫಸ್ಟ್ ಡೇ ಹೇಳಿದೆ, ಒಂದು ವಾರದಲ್ಲಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಇರದೇ ಇದ್ದರೆ ಪ್ಲೀಸ್ ಗೆಟ್ ಅಡ್ಮಿಟೆಡ್. ಸೆಕೆಂಡ್ ಟೈಮ್ ಶಿ ಕೇಮ್, ಶಿ ಟೋಲ್ಡ್ ಮಿ ಶಿ ವಾಸ್ ಬೆಟರ್. Because she is better, I told okay fine, chalo, she is better, then let us not trouble her. Third time she came in a lot of pain. So I told her, no question, you have to get admitted. And her sugars are also all haywire. For which we started admission on day one only. Whatever doubts I have, I sent all for investigation. Reports nalli avaraddu idu tumba jaasti. ESR ಮತ್ತು CRP ಎರಡು ಕೂಡ they are beyond, much beyond what is abnormal level also. ESR is above 150.
What is ESR?
I'll tell you. They are inflammatory parameters.
Okay.
They are very high if you have a hidden infection in your body, which is usually infection of the bone, something like tuberculosis, or you have a long-standing infection in your body, or you have something more serious than that. So along with that, since it was high, immediately I told him to draw a sample on Friday, Thursday whenever she got admitted, to send to Bangalore for a second evaluation for something called a serum electrophoresis. That report has come on Saturday night.
Okay.
She is positive for something called multiple myeloma. Multiple myeloma, and she is very strongly positive, not weakly positive, strongly positive. Multiple myeloma is called as the cancer of the plasma cells. So there are certain cells in the body which are secreted from the bone, from the myeloid tissue, that is called plasma cells. So when you have a cancer of the plasma cells, one of the most common symptom is severe unresolving back pain. That is, it will not improve on, you can take a video. Okay. This is called the M band.
Okay.
The M band, when it is positive, it's about like this. But in her case, it is very high. It's about 1.7. That is too high.
Okay.
So you can see here, M band detected in gamma region and advised immunofixation study and all these things. Now this is an indication, something like to say that 50% chance, or little more than 50%, that she has multiple myeloma. But then it is not, what do you say, before we start treatment for the same, we will have to have 100% confirmation. Because I'm afraid the treatment is long and the treatment is little painful. Maybe for her, because she is little afraid of injections and needles and everything.
Right.
The evaluation itself requires bone marrow aspiration and also other electrophoresis evaluations. Okay. So once those reports come positive, she might require chemo. But then I am not somebody who would start something called prophylactic chemo. Report baro modle treatment start ಮಾಡೋದು ನನ್ನ ಅಭ್ಯಾಸ ಇಲ್ಲ, because ಅದರಲ್ಲಿ ವಾಂತಿ ಬರೋದು ಅದೆಲ್ಲ ಪ್ರಾಬ್ಲಮ್ ಇರ್ತದೆ. And chemo is not done by me, it's done by the oncologist. So what I would advise to you, we have two options. You can discuss with her daughter. The first option is, you can either, if you want to continue treatment with us, we will have to give a reference to an oncologist who will come and see her and design the best line of treatment for her. He will ask for a bone marrow aspiration, which I will have to do it myself. But the thing is, I cannot administer anything apart from local anesthesia to do the procedure. It's a 15-20 minute procedure. But some patients do not tolerate that pain. Sedation, sedation and all, I will not advise in her age, or any general anesthesia for that matter, considering her reports, considering her age, considering her respiratory infection. So, adu ಮಾಡಿ, then once we are confirmed it is, then we institute treatment. But I don't know if the oncologist will be comfortable to give chemotherapy here. And if radiotherapy is required, radiotherapy locally is available only in Manipal. Illadidre Mangalore. But Mangalore, transporting her, unless and until she has a house there, it's not worth. Second option, you take her to Manipal or Mangalore and you continue treatment there. Manipal, I don't have contacts, but I can try to get some contacts, because we have some consultants and some sisters from Manipal. They might be able to help you regarding contacts.
Okay.
Illa Mangalore, I have some contacts. I can get it done because I did my education in Mangalore, so I know a lot of doctors there. So this is what we can do. This is her comprehensive line of treatment. The back pain will not respond to conventional treatment because the back pain is not due to age or bone or anything like that. It is because of this. So this has to be correct. So it is a little long process. It is a little painful process. Prognosis depends from patient to patient. Prognosis means, you know what is prognosis?
Yeah, it's a
Yeah. What is the chances and all.
chances of recovery.
So some people do very well, live quite long. Some people don't do very well. ಸೊ ಅದಕ್ಕೆ ಸ್ಟೇಜಿಂಗ್ ಎಲ್ಲ ಆಗಬೇಕು, ಯಾವ ಸ್ಟೇಜಲ್ಲಿದ್ದಾರೆ, ಸ್ಕ್ಯಾನ್ಸ್ ಬೇಕಾಗ್ತದೆ, ಅದೆಲ್ಲ ಇವ್ಯಾಲ್ಯೂಯೇಷನ್ ಬೇಕು. ಶಿ ವಿಲ್ ರಿಕ್ವೈರ್ MRI ಆ್ಯಂಡ್ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಸೊ ಅದೆಲ್ಲ ಥಿಂಗ್ ಈಸ್, ಇಫ್ ಯು ಹ್ಯಾವ್ ಸಮ್ ಗುಡ್ ಇನ್ಶೂರೆನ್ಸ್ ಇಟ್ ವಿಲ್ ಕವರ್ ಎವ್ರಿಥಿಂಗ್. ವಿಲ್ ಹ್ಯಾವ್ ಟು ಇಲ್ಲಿ ಕಂಟಿನ್ಯೂ ಮಾಡೋದಾದರೆ ನಾನು ಪ್ರೊಸೆಸ್ ಇವತ್ತು ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತೀನಿ, ಬಟ್ ಯು ವಿಲ್ ಹ್ಯಾವ್ ಟು ಸ್ಟೇ ಇನ್ ದ ಹಾಸ್ಪಿಟಲ್ ಫಾರ್ ಅ ಲಾಂಗ್ ಟೈಮ್ ಆ್ಯಂಡ್ ದ ಬಜೆಟ್ ವಿಲ್ ಕಮ್. I will not tell it's going to be cheap. Anywhere you go, it will come.
Yes.
Illa second option ನಿಮಗೆ ಹೈಯರ್ ಸೆಂಟರಲ್ಲಿ ಇದು ಮಾಡಬೇಕಾದ್ರೆ, ವಿಚ್ ಐ ವುಡ್ ಸೇ ಇಸ್ ಅ ಬೆಟರ್ ಆಪ್ಷನ್, ಬಿಕಾಸ್ ನಮಗೆ ಈಗ ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಅವರಿಗೆ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಆದರೆ ದೆನ್ ವಿ ವಿಲ್ ಹ್ಯಾವ್ ಟು ರೆಫರ್ ಟು ಅ ಹೈಯರ್ ಸೆಂಟರ್. ಅರ್ಥ ಆಯ್ತು ಹೇಳಿ. ಐ ಆಮ್ ನಾಟ್ ಟೆಲಿಂಗ್ ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ದ ಕೆಪಬಿಲಿಟಿ ಟು ಡೂ ಇಟ್, ಬಟ್ ಇನ್ ಸರ್ಟೈನ್ ಸಿಚುವೇಷನ್ ಕನ್ಸಿಡರಿಂಗ್ ಅರ್ ಏಜ್ ವಿ ವಿಲ್ ಹ್ಯಾವ್ ಟು ರೆಫರ್ ಟು ಅ ಹೈಯರ್ ಸೆಂಟರ್. ಸೊ ಹಾಗಿದ್ದ ಸಿಚುವೇಷನ್ನಲ್ಲಿ ನೀವು ಫಸ್ಟಿಗೆ ಹೈಯರ್ ಸೆಂಟರಿಗೆ ಹೋಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತೀರಂದರೆ ದಟ್ ಇಸ್ ಅ ಬೆಟರ್ ಆಪ್ಷನ್. But because it is a long treatment, you will have to decide where you want to do it. You will have to think about the doctor. You will have to think about the logistics. ನಿಮಗೆ ಈಗ ಮ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ನೀವು ಸ್ಟಾರ್ಟ್ ಮಾಡೋದು ಮಾಡ್ತೀರಿ, ಮತ್ತು ಲೇಟರ್ ನನಗೆ ಬರ್ತಾ ಇರಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ, ನನಗೆ ಮಣಿಪಾಲಲ್ಲಿ ಮಾಡ್ತೀನಿ. ಡೋಂಟ್ ಚೇಂಜ್. You start in Mangalore, you continue in Mangalore. You start in Manipal, you continue in Manipal. You start somewhere else, you continue there. You do not change. That you have to think and discuss with the family.
Okay.
ನಮ್ಮ ಸೈಡಿಂದ ನಾವು ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ತೇವೆ ಇವತ್ತು. There is no active treatment from my side or from Dr. Shruti's side. Diabetes control is the main thing. She says she doesn't want insulin, but on the long run she will require insulin because for her problem, insulin is the safest treatment. Tablets will have side effects. Tablets will have issues. She has very high sugar, for which we need to protect her kidney. See, if you are going to give chemo, the kidney and the heart has to be very strong. If they are not strong, the medicines will kill her. Because they will damage the kidney, they will damage the intestine, they will damage the heart, they will damage everything. So if we are going to give all those things needs to be protected. And for that we can't give pumping tablets for her. The safest is insulin. So she will require insulin. So ಇದೆಲ್ಲ ಅವ್ರ ಹತ್ರ ಡೈರೆಕ್ಟ್ ಡಿಸ್ಕಸ್ ಮಾಡಿದರೆ she will have a lot of mental setbacks and she'll get disturbed. So I wanted to discuss with somebody who's taking decisions and I'm clear about it. I cannot talk to her all these things.
Right.
And she's old. When she's old, her decision making also will be clouded, and she might take some emotional decisions which are not safe for the patient and for the family. As far as I know, her daughter is abroad.
Her daughter is in Canada.
Correct. ನೀವು ಅವ್ರ ಹತ್ರ ಮಾತಾಡಿ, ಡಿಸ್ಕಸ್ ಮಾಡಿ, ಇವತ್ತು ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ಬೋದಾ? ಯು ವಿಲ್ ಟೇಕ್ ಹರ್ ಹೋಮ್? You tell me, because she is asking for discharge. If she has to stay for one more day, you will have to convince her. I can't convince her. As soon as that, she will think something is serious. She will, why are you keeping me in the hospital? So you tell me. You have to tell her that, there is some problem at home. You stay for one day and tomorrow we'll take you. You have to tell that. I can't tell that.
Okay.
So ನಮ್ಮ ಸೈಡಿಂದ ಆಕ್ಟಿವ್ ಆಗಿ ಇದಕ್ಕೆ ಇನ್ನೂ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲ. ಬಿಕಾಸ್ ಒನ್ಸ್ ದ್ಯಾಟ್ ರಿಪೋರ್ಟ್ ಕಮ್ಸ್, ದ್ಯಾಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಸ್ಟಾರ್ಟೆಡ್. ಸೊ ನೀವು ನಿಮ್ಮ ಫ್ಯಾಮಿಲಿ ಒಟ್ಟಿಗೆ ಡಿಸ್ಕಸ್ ಮಾಡಿ, ನಿಮ್ಮ ರಿಲೇಟಿವ್ಸ್ ಒಟ್ಟಿಗೆ ಡಿಸ್ಕಸ್ ಮಾಡಿ, ನಿಮ್ಮದು ಡಿಸ್ಕಷನ್ ಮಾಡಿ. ಇಫ್ ಯು ವಾಂಟ್ ಟು ಟೇಕ್ ಅ ಡೇ, ಯು ಟೆಲ್ ಹರ್, ಕನ್ವಿನ್ಸ್ ಹರ್, ಕೀಪ್ ಹರ್ ಫಾರ್ ಅ ಡೇ. ಟುಮಾರೋ ಮಾರ್ನಿಂಗ್ ಹ್ಯಾವ್ ಅ ಕಂಪ್ಲೀಟ್ ಪ್ಲಾನ್ ವೇರ್ ಯು ವಾಂಟ್ ಟು ಗೋ and you can do. If you want the oncologist to have a look, I'll try to request him to come. In case he comes, he can have a look. So you let me know all these things once you have discussed with her
Family.
Close family.
Okay.
This is my total scenario of what is there and what has to be done.
Okay.
If you have any doubts, you can ask me. No problem. We
Okay.
give you all the time.
No, I don't have any doubts right now, but then I think family might have some questions, and her daughter said she would like to speak to the doctor.
Yeah.
So I'll let her know that
Tomorrow morning when I come for rounds at around 10:30, 11, somebody can connect me via the phone to her. I will talk to her in detail.
Okay.
Away from the patient, not in
Okay.
front of the patient. In front of the patient, I will not talk anything.
Okay.
Unless and until the attender tells me to talk. Because finally, see, I can come and I can tell that you have this problem and walk out of the room. Eventually, what happens, the patient's emotional trauma, you have to handle. I don't have to handle. I can just walk off. That is why I never tell until and unless you give me the permission to talk to her. If you want me to talk to her, I will talk to her. But then, it becomes a problem for you.
Right.
So if you want to emotionally calm her down and then talk to her, then that's up to you. You can take a call on it. You tell me how that has to go and how you want it to sort out.
Okay.
And you have a treatment, have a plan. See, these are the options. Mangalore, I can get something done. Bangalore also, if you want, if you have some contacts, there are good onco hospitals. We can get something. Even in site care and in HCG, both places I have good contacts. Manipal, we have some network here, we can try to get it done. Dr. Dhananjay and all, they're all from Manipal, so something we can do. Logistically speaking, if you are from Udupi, Manipal is the best bet because it's close by.
Right.
Aita. But once you go into these big hospitals, we lose contact of it. They will notify madudu. Unless and until they feel something is this one and the patient says that I want to this one, then only. Illadre namge ಏನು ಗೊತ್ತಾಗೋದಿಲ್ಲ half the time. So ಅದಕ್ಕೆ we can just guide you towards that direction. ಇಲ್ಲಿ ಮಾಡಬೇಕಾದ್ರೆ ಅದು ದೊಡ್ಡ ದೊಡ್ಡ ಕೀಮೋ ಎಲ್ಲ ಇಟ್ ಬಿ ಲಿಟಲ್ ಡಿಫಿಕಲ್ಟ್ ಫಾರ್ ಅಸ್ ಲಾಜಿಸ್ಟಿಕಲಿ ಸ್ಪೀಕಿಂಗ್
Right.
ಆಯಿತು ಬಿಕಾಸ್ ಕಾರ್ಡಿಯಾಲಜಿ ಅದೆಲ್ಲ ಬೇಕಾಗ್ತದೆ ಸೊ ದಟ್ ಇಸ್ ದ ಥಿಂಗ್ ಸೊ ಯು ಟಾಕ್ ಟು ದ ಡಾಟರ್ ಯು ಲೆಟ್ ಮೀ ನೋ ಹೌ ಯು ವಾಂಟ್ ಟು ಗೋ ಅಬೌಟ್ ದ ಬ್ಯಾಕ್ ಪೇನ್ ಶೀಲ್ ಕೀಪ್ ಕಂಪ್ಲೇನಿಂಗ್ ಇಟ್ ಟು ಯು ಅಂಟಿಲ್ ಅಂಡ್ ಅನ್ಲೆಸ್ ವಿ ಡೂ ಸಮಥಿಂಗ್ ಅಬೌಟ್ ದಿಸ್ ಬ್ಯಾಕ್ ಪೇನ್ ವಿಲ್ ಬಿ ದೇರ್ ಶಿ ವಿಲ್ ಟೆಲ್ ದಟ್ ದರ್ ಇಸ್ ಬ್ಯಾಕ್ ಪೇನ್ ನನಗೆ ತುಂಬ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಇಲ್ಲ ಆ್ಯಂಡ್ ಆಲ್ ಶಿ ವಿಲ್ ಟೆಲ್ ಬಿಕಾಸ್ ಐ ವಾಸ್ ವೇಟಿಂಗ್ ಫಾರ್ ದಿಸ್ ರೈಟ್ ಫ್ರಮ್ ಡೇ ಒನ್ ಸೊ ದಟ್ ರಿಪೋರ್ಟ್ ಕೇಮ್ ಸ್ಯಾಟರ್ಡೇ ನೈಟ್. Last evening also I have spoken to her, but I have not told her about this because until I speak to you, I don't want to talk to her.
Okay.
Okay? Is that fine?
Yeah.
Yes.